fact that the lower jaw is not grown enough.
He does not seem to have a tongue, where patients are born with micrognathia.
So where you can appreciate the advancement again.
I've not touched the upper jaw, mind you, because the upper jaw growth is normal.
We've augmented the lower jaw by 22 millimeters. We did a sliding type of double osteotomies in order to get the length of the bone without having to put device inside. Boy has a severe facial issue. You can see this. It's very obvious. He has a problem with the fact that the lower jaw is not grown enough. இப்படி பண்ணுடா முன்னு கொண்டு வா இன்னும் முன்னு கொண்டு வா முன்னு கொண்டு வரணும் கீழ்த்தடைய இப்படி முடியாதுல்ல. He's not even able to bring his lower jaw forward. It's that retruded. It's a normal way. So we're going to be doing 2 osteotomy for him. One at the sagittal area of the mandible, and then one also extended genioplasty. So we're going to get his face into much proportion. Since he's a young guy, I'm not going to be doing any procedure on the upper jaw for the moment. It's going to be 2 osteotomies, lower jaw, and then if needed, he'll be on braces. We're going to plan the mock surgery and everything today and plan the surgery for him tomorrow.
So this is a 14-year-old boy, and as you see inside his mouth, he does not seem to have a tongue. That is because he's a case of Pierre-Robin syndrome. And why? Close pananga, mudunga. So you see the micrognathia, which is very much evident. His upper jaw has grown well, but the lower jaw the jaw growth has been restricted. Back in 2013, we've already done a distraction in this. These are the scars from the distraction site, and we've brought the mandible forward. Now this patient has again come to us for a lower jaw surgery. We are going to perform osteotomies on both sides posteriorly of the mandible, bring the mandible forward along with an extended genioplasty so that the chin is pulled forward. Now in his case, why we are doing orthognathic at such a young age is because his jaw growth is restricted and we do not expect it to grow any further. Now surprisingly, நீ 1 to 10 சொல்லு, தமிழ்ல சொல்லு.
1 2 3 4 5 6 7 8 9 10.
So surprisingly, his speech is quite good and quite comprehensible for a patient who has a rudimentary tongue. Why open panna? Yeah, you can see that. Something is a lot of decayed teeth also, which are going to be knocked off. He has a lot of work to be done with when it comes to orthodontics and his dentition as such. So here we have this young boy who is our old patient, and back in 2013 we have done a mandibular distraction for him, and as you see, he has what we commonly call as buck teeth. His upper jaw is forward. That is not because something is wrong with the upper jaw. Actual problem lies in the lower jaw. He has something called as he's a case of Pierre-Robin syndrome, where patients are born with micrognathia, that is a small jaw and almost a rudimentary tongue. Why turunga? So you see he doesn't have a tongue, almost a very small one, something very unusual to see, very rare again. Okay, close. So this scar that you see, it is from the distraction we have done for him years ago, and today we are going to do a bilateral sagittal split osteotomy along with a genioplasty for this kid. That is to bring his lower jaw forward, and his dentition is very we are going to take care of his dentition post-op with the help of orthodontics. He has quite a few decayed teeth which are going to be knocked off. So we have done a mock surgery, done all the splints, and we brought the lower jaw forward and by about 10 millimeters or so, because he requires that much advancement. And this is going to take us about over an hour, and he should be back in the ICU. All the whole surgery is going to be performed inside the mouth, so he won't have any issues about scarring, and he can have a good profile hereafter.
So you can see the tongue is not developed. It's like a mass. The whole tongue is a mass here, and there's a small inlet. That's all. Check.
60, 36, sir.
70.
You now. So where you can appreciate the advancement again. And look at that. He literally didn't have a chin. I hope you can appreciate this. And
நாளைக்கு நீங்க கிளம்பலாம். Alright, so this is POD4 following a BSSO, a huge advancement for this boy. He's a case of Perry-Robin syndrome, and years ago when he was a child, Dr. Richardson has performed a distraction osteogenesis for him, and now he came with a severe micrognathia of the lower jaw. This baby has a rudimentary tongue. He's currently 14 years old, and we've done such a huge advancement. That is main, and we've not touched the upper jaw, mind you, because the upper jaw growth is normal, but the lower jaw was way too posteriorly placed, so we pulled it forward. We've not done anything to the chin, only osteotomies bilaterally, and his profile is already looking straight. He's looking good. Tomorrow maybe we make him sit, and we'll show you the pre-op and the post-op outcomes.
சூப்பர் கடி இந்த உதடு இப்படி கொஞ்சம் மூணு பக்கம் இப்படி அது சரியாயிரும். கொஞ்ச நாள் நம்ம வச்சிருக்கனால அப்படி இருக்கு. दिखाओ पूरा बिफोर आफ्टर दिखाओ इसका देखता हूँ. முடிஞ்சிடா. சின்ன லைட்டாக வலிக்கும். சரியா? மெதுவாக தான் எடுப்பேன். फ्रंट व्यू दिखाओ. हाँ साइड व्यू दिखाओ. हाँ. So you can see that jaw of his. He literally didn't have a jaw, lower jaw. We've augmented the lower jaw by 22 millimeters, 2.2 centimeters. We're going to take a scan and show you that as well. And he's a very brave boy, as you can see. He's withstood the surgery, didn't cry. He's happy to do friend view dikhao. And that's how he was. You can see this. Look at that view and look at him now. Why a little more? Okay, so there's still a lot of swelling because we've just taken down the dinoplast. The lip is going to go back like this. Why, Tara? He's got a lot of problems with his teeth now, but at least you can see his lower teeth. You couldn't see his lower teeth at all. So we're going to show you different views for you. Yeah. In the Pakam Parma, what are the carriage? You can see that view. Huge improvement. Look at that upper lip. Look at the position of the lower lip, the jaw angle. Okay. Again on this side. This length. Right. So in many of our patients, we do what is called as distraction osteogenesis for kids like him, meaning we create new bone in the patient's jaw itself with the help of devices. I'm sure you would have seen videos like that. In this case, however, we did a sliding type of double osteotomies in order to get the length of the bone without having to put device inside, because it already crossed that age for distraction and because this was feasible. So it isn't that one particular technique works for all patients, but you've got to choose the right technique for the right patient and for the right purpose. And as you can see, this is so just 5 days now, and you saw that transformation. He's going to go home today. He doesn't live very far from here. It's about 60-70 kilometers from our hospital. So he'll come back again after a few days for a review. But if he's living far, then we would ask him to stay over with us a little longer. So he doesn't have any pain. And the a slight pain here. Now he says, he's able to eat food in the sense liquid and semi-solid at the moment. Liquid தான் கொடுக்கணும், அதான் கொடுக்கணும். இன்னும் ஒரு வாரம் அதே தான். இன்னைக்கு வீட்டுக்கு போயிட்டு ஒரு 5 நாள் 6 நாள் கழிச்சு வாங்க. அது வரைக்கும் அதே ஆகாரம் கொடுங்க. அடுத்த வாட்டி வந்த அப்புறம் என்ன பண்ணணும், எப்படி பண்ணணும், அடுத்த ஸ்டெப் சொல்லி தரேன். ஆப்ரேஷன்லாம் முடிஞ்சது. சரியா? ஸ்கேன் எடுக்கணும் இப்போ. ஸ்கேன் நிக்கால் दो. போட. இப்படி சாப்பிட முடியாது இப்போ. நாள் ஆகும் இதெல்லாம். கட்டுது. பல்லு வரிசையா இல்லைல்லம்மா, கொத்து கொத்தால உழைஞ்சிருக்கு. வாய் வளர்ச்சி இல்லாதனால பல்லு இப்படி நமக்கு வர்றது மாதிரி இப்படி வர்றதுக்கு கொத்த வந்துச்சிடலாம். அப்போ அதனால நம்ம இப்போ பல்லு தெரியுது உங்களுக்கு. நீங்கள் என்ன பண்ணணும்னா அதில் கிளிப்பு போட்டு கொஞ்சம் நம்ம வரிசை கொண்டு வர முடியும்னா பண்ணணும். கொஞ்ச நாள் ஆன பிறகு ஒரு 3-4 மாதம் கழிச்சு பிறகு பல்ல ரெடி பண்ணணும். ஓரளவு வரும். இனி அவனுக்கு மூஞ்சி ஓரளவு கிளியர் ஆகிடும் இந்த முடிச்சதும். அடுத்து நம்ம பல்லு பண்ணுறப்ப இந்த உதடில் தண்ணி வரும், வெள்ளை வந்துட்டு இருக்கிறதெல்லாம் கிளியர் ஆகும். நாக்கு வெளியில் வந்துச்சு ஆல்ரெடி. பெருசாக்கில் தாடை கொண்டு நாக்கு வெளியே கொண்டு வந்தாச்சு. நல்லா வாய் திறக்கும், நீங்கள் நாக்கை பார்க்கலாம் பிறகு. ஹலோ, குட் மார்னிங். ஓகே, ரிப்பீட் சொல்லுங்கள். ஆமாம், இன்னும் 5 நாள் வரணும் கண்டிப்பாக. लेके जाओ.